Good evening, I'm Dr. Kelly Burkenstock, owner of Skin Body Health in Mandeville, Louisiana and New Orleans, Louisiana. We're also licensed and we do live conventions and meetings and Botox and other events in Alabama and Florida. Nationwide, we're able to help all of our hormone clients as we do a lot of international and national sexual health. Tonight we're going to speak about something near and dear to my heart. As a long-standing member since 2014 of the International Academy of Cosmetic Dermatology, we love to announce when things finally become more of the norm and finally become a more natural look. What am I talking about? Well, lip filler. We all have seen those horrible duck lips, and sometimes when the girls are getting 3, 4, even 5 different tubes and their lips are hitting the door before their hand is on it. It's just not a pretty look. But we're here to say that there is a very natural way to do lip filler that actually enhances the face and the look, whether you're a college girl or the ladies in their 80s and everywhere in between. So it is becoming a much more popular trend amongst our youth in college, 20s and beyond. And the reason why is social media. So in social media, we're seeing more of ourselves, we're seeing selfies, celebrities are right there in our home all day long on our TikTok and Facebook and Instagram. So it's becoming a thing that the younger people want. When you were young, if you're one of the baby boomers, all that wasn't available, and all that was available was the red or hot pink Maybelline lipstick. Now we're here to say there's something different. So, Lip Fillers 101. Let's tell you a little bit about it and what you can expect. The non-surgical cosmetic industry is booming internationally, not just in the United States. And for the procedures that were once out of reach for the normal housewife, college student, or young person that might be early in their career, it's now more affordable. Lip fillers can range in cost from anywhere from $350 to $900, depending on the size of the tube and what brand, Versa, Restylane, Juvederm, or the like. How long do they last? They can last 6 to 18 months. Some of it depends on your personal immune system and how fast you process different proteins called hyaluronic acids. And the fillers are known to your body. So you already have hyaluronic acid in your body. So these protein cross-linked hyaluronic gel fillers are something that the body knows, and we're just adding more to a certain area of the body. So they're surging in popularity, and we even, as we said, have ladies in their 80s coming in for their lips. With February being the month of love, that's typically the month where we do the most lips. By and large, ladies line up for their lips in February. We do them all year long. I just think with February and Valentine's and kissing and hearts everywhere, it just becomes something that's more on the edge of their mind. So whether you've got a hot date with your Valentine or you're planning a girls' night out for Valentine's Day, getting some new natural lips may be the best treat or present that you get for yourself. We can plump them and make them look more defined and beautiful without having them reach out and look like duck, overblown lips. Indeed, you can be creative with some lip color and makeup, but why not strive for a little bit of lip filler? Well, what are they? They are hyaluronic acid, as I said, which is a protein that's found in the body, and when we add it to the lips, it just fills them out beautifully. On a younger person, you're going to get more of a volume lift. On an older person, you're actually going to return the pink of the lips, because as we age, the pink of the lips decrease and diminish and sort of fold and turn in. And so that can add a lot of aging to the face. And when you simply add one simple tube of filler, it does not overdo anything. But what it does is recreate that youthful pink lip that you had when in your younger years. So hyaluronic acid is a humectant, meaning that it draws moisture. So it actually makes the lips a little bit more moisturized as well when you're wearing the lips. I particularly like the brand Versa. Versa to me is the smoothest, most natural looking lip product that looks and feels and kisses just like a natural lip. So we want to reduce the visible signs of aging, and when we get those lip lines around our lips, that can make us look like a smoker. We're seeing more lip lines today in even people who aren't smokers, and there's a reason why. With the popularity of water bottles, which is only something of the last 25 or so years, we're doing a lot more puckering than we used to do. So ladies and guys are getting more lip lines than they ever have before, because they're puckering much like the action of a cigarette, where we used to call those cigarette smoker lines. So if you're going to drink water out of a bottle, or from a bottle, or a Coca-Cola, or what have you, I highly encourage you, don't use straws. Pour everything into a glass, because when you're drinking out of a glass, you're not going to be making that pucker pout that's going to cause excessive lip lines and actually wear down or prematurely age the lips. So often people ask me, well, can I put Botox in my lips? That is sort of a yes and a no. So Botox won't fill the lips, but on the individual lip lines above and below, you can use a little bit of Botox there to smooth those lines out. However, that won't fill and plump the lips, which lip filler will. Also, with someone with very skilled hands that's had a lot of training, and as most of you know, I've trained internationally with luminaries around the world, we also use lip filler around the mouth to smooth out those lines. So you can use a little bit of Botox, you can use lip filler if you're skilled as such, or you can use a little bit of both. In the interior of the lip, always is lip filler and not Botox at all, because you could give someone a drool and make them look like as if they had a stroke or a Bell's palsy, which is not a pretty look. The most wonderful thing about any of the lip procedures are that they are short-term enhancement. So 6 to 18 months. So if it was something that you were really disappointed in for some reason, or you went to someone that wasn't as skilled as you thought they were, then by and large it's going to go away, and you have your lips back to the way they were. Hopefully though, you go somewhere where you're getting this skill and you're just enjoying those natural lips. So do look for expertise when you're getting lip filler. And by and large, it's a very, very safe procedure. However, it is a needle going into the skin, so you could get an infection. Also, or some sort of a little abscess. If you're prone to cold sores or fever blisters, something like that could pop out. Of course, you could take the Valtrex or any other medication that would simmer that down. So no, the fillers don't give you herpes, but if you have that tendency to cold sores or fever blisters, which is just a little herpes simplex, then you would treat that with the Valtrex. One of the rarest complications that we hate to see, and I've never personally had it happen at my clinic, but I've had to do some corrections behind other practitioners, is if you put the gel in the wrong place, you can cause a skin necrosis, which means a destruction of the cells of the lip, and you can actually cause some cell death and a little hole in whatever area that problem occurred. Over time, that can be worked on and cured, but it's certainly not something that anyone would like. I'm often asked about, does it hurt? Well, it's a little painful. It is a needle. However, we use a triple cane numbing cream: beta-cane, tetracaine, and lidocaine. Those three canes, when tripled together, give you just beautiful, beautiful numbing, and it becomes virtually painless. Also, within the hyaluronic acid gel, we put lidocaine, so that as we're injecting, the numbing gel inside of the product also starts calming down that immediate little pinprick as we inject. How long does it take? Takes all of 5 minutes. Matter of fact, we're going to do a demonstration this evening live here for you. And we'll show you just how quick and fast it is and just how beautiful it comes out. So don't be concerned if you get a little swelling or a little bruising after the treatment. That's completely normal. So the products do tend to cause the lips to swell a little bit, just as if you had hit them, your lips swell tremendously because of all the little circulation and nerve endings of the lips. But within a day or two it calms down beautifully, and then you get to enjoy your new and luscious lips. You can apply a little bit of ice pack in a pinch, but by and large you really don't need to know that. It really shouldn't need to do that. You can know it, but you don't need to do that. So lip fillers can be an excellent gift for yourself, whether you're celebrating with your partner or want to show yourself some self-love. They're long-lasting and quick to show results, making them a great choice for an enhanced, attractive, and youthful smile. So if you haven't been with us before, we're on our YouTube channel, Dr. Burkenstock Skin Body Health. Our Facebook pages, Dr. Burkenstock Skin Body Health and Kelly Burkenstock. And our website is skinbodyhealth.com. That's skinbodyhealth.com. So if you'd like to bring a friend, we're doing a special where we're doing 2 lips for $6.99. So bring a friend, and you and your friend can both get lips and share, and it's a BOGO, buy one, get one. 2 lips for $6.99. Normally our lips do retail for Versa at $600, but we are running this special all throughout the Valentine's month. If you'd like, you can go to our website, skinbodyhealth.com. You can look at our product store or any of our skincare products or vitamin lines. Please like and share us. We want to share our information with your family and friends, and maybe we can help them with some of our information. We've been on the YouTube channel for years, so you can go back and look at any of our YouTubes on anything from hormones and sexual health to male penile health to diabetes, skin care, Botox, lips, hair restoration. We're all about anti-aging and helping you live your best longevity and vitality and live your most gorgeous life. I'm going to bring up a client of ours now, Miss Cynthia. Miss Cynthia, welcome.
Thank you.
And today we're going to be doing her lips. Miss Cynthia is a dash over 40. We won't say how old. And what we're going to do is we're going to enhance the pinkness of the lips. So in here, her pink has folded down, as often happens as we approach and go through menopause. And it continues to get the pink get less, and that's what really sort of ages the face. So as you'll see, as I inject over the next 5 minutes, it's going to actually bring the pink back into view, which is a very, very youthful look. So without further ado, we'll start. We've put some beta-tetralidocaine, our triple numbing cream, on Miss Cynthia about 15 or so minutes ago, and so it's all soaked in and she is ready to go. Once again, in a good practitioner's hands that knows not a cookie cutter technique, something they learned at a weekend course, but has actually trained in facial anatomy and knows that every individual's face is different, you're going to want to use the proper technique for the proper face and the proper set of lips. It is not a one-size-fits-all. So this is our Versa, my favorite. We also do use Restylane and Juvederm. I'm just really love this one because it does give such a natural look, and the fill just stays in place lovely, and it lasts very, very long.
A question came through that says, what are the precautions for after getting my lips done?
What we would do is instruct somebody, definitely don't smoke or suck on water bottles or Coke bottles, because you can move the product for 48 hours, not with gentle brushing or walking and talking. That's all fine. But certainly if you moved it around with your hands or fell asleep on it, you could possibly move the product for 48 hours. Okay. And actually I tell people, If you get a little bit of swelling, let it swell, because what's happening is your collagen, your natural collagen, is getting aggravated by the hyaluronic acid product, and so you're actually, it's the gift that keeps on giving. You're actually making a little bit of your own natural collagen with that swelling and aggravation, so it's better not to calm down the swelling. Just let it happen. In a day or two it'll be over, and you can enjoy your luscious lips. And when the product does wear off, those new little collagen bundles that did form stay there with you. There you go. So we'll put Miss Cindy's before and afters on our website, and you can see how her lovely pink has turned back out on her lips. And that's it. So pretty quick. I'm sure it wasn't wonderfully a wonderful joy, but how was it in terms of pain?
Tolerable. I mean, it was fine.
Okay, good. We thank you. She looks gorgeous. Let's get your stand. So we don't have anything duck whatsoever, but we do have a beautiful pink show where we didn't before. And what we will do is we'll put up the before and after pictures on the website so you can see them side by side. And it's just a little bit natural. We can always go back and put in more, another tube if someone would like. We can always stay with a soft, natural pucker. It's all up to you. That's the beauty of fillers, because you can always come back and add more, and you can always just go subtle. It depends on you and what you like. The thing that you don't want to do is to come out with the pointed duck lips. That's what makes things look unnatural and just not pretty. It's just not a pretty look at all. But she looks absolutely gorgeous. Thank you, Cindy.
Thank
we
you.
certainly appreciate it. So Miss Cindy was the example of our beautiful menopause queen. And happy birthday, Miss Cindy, by the way.
Thank you.
You're welcome. And now, here's our college student. So, as we said, from the 20s to the 80s and everywhere in between, ladies are loving their lips. So, she wanted to get, this lovely Miss Sophie wanted to get her lips done for Valentine's Day, so that's what we're going to do. So, I put some lidocaine into the Versa. So that's why I'm swishing it back and forth to get a nice mixture, because we wanted a lot of lidocaine, so as we injecting, the client is not feeling. So on someone that's young, the pink show is already here, and what you need to be able to do is to go into the proper part of the anatomy so that we're enhancing and not poking out in a rigid duck-like fashion. Okay, the top's done. We're going to move on to her bottom lip. Okay, and we're done. Okay, so we're going to walk up a little bit closer so everybody can see. Lovely enhanced lips, with a gorgeous M shape that we've recreated, and they're a little plump, they're a little enhanced. They will calm down in 48 hours, but they're not duck. They're just beautiful and natural looking. They look gorgeous. Okay. Yes. Thank you, Sophie, for coming in. All right, so we appreciate you as always for visiting with us. We'll be back next Wednesday, and we'll have a brand new topic for you. If there's any topics that you'd particularly like to hear, go ahead and email us at info@skinbodyhealth.com. That's info@skinbodyhealth.com. I'm Dr. Burkenstock. It's been a pleasure talking with you.